Lower back pain and diarrhea, causes and treatment. Lower back pain and diarrhea are common symptoms, but they are not always connected. Sometimes people may experience both at the same time for different reasons. However, some conditions can cause both symptoms. Examples include celiac disease, painful periods, and kidney infections. Consult a doctor if diarrhea persists for more than 2 days or, or if symptoms of dehydration, high fever, severe abdominal pain, bloody stools, or loss of bowel control develop. Continue watching to discover more about the conditions that can cause both lower back pain and diarrhea, including their symptoms and available treatment options. Celiac disease. Celiac disease is an immune reaction to gluten that causes inflammation in the small intestine and affects body's ability to digest nutrients. Gluten is a protein naturally present in wheat, barley, and rye. Celiac disease tends to affect children and adults differently, and symptoms can vary considerably from person to person. However, it often causes chronic diarrhea, and some adults experience bone and joint pain, which may develop in the lower back. Some other symptoms of celiac disease can include bloating and gas, fatigue, unexpected weight loss, anemia, depression, headaches, canker sores. Treatment. The main treatment for celiac disease is switching to a gluten-free diet. A doctor may refer a person to dietitian who can provide guidance on how to avoid gluten while still eating healthful, balanced meals. It is also important to check that other products do not contain gluten, including medications, vitamin and mineral supplements, cosmetics and skin and hair care products. Toothpastes. Dysmenorrhea. Dysmenorrhea is the medical term for painful menstrual periods. In addition to painful cramping in the abdomen, some people also experience pelvic pain that radiates to the lower back. Other symptoms of dysmenorrhea can include diarrhea, nausea and vomiting, fatigue, difficulty sleeping. Treatment. Many people with dysmenorrhea find relief from over-the-counter medications such as ibuprofen, aspirin, and naproxen. If these treatments are unsuccessful, a doctor may prescribe stronger pain medications or hormonal medications. They may also recommend tests to determine the underlying cause for dysmenorrhea. Other treatment options can include lifestyle changes such as exercising regularly, stopping smoking, and getting more sleep. Relaxation techniques such as massage, yoga, and pilates. Using hot water bottles or taking warm bath or showers. Alternative therapies such as acupressure and transcutaneous electrical nerve stimulation, which some people refer to as TENS. Diverticulosis. Diverticulosis is the term for small bulges or sacs called diverticula, forming in the wall of the colon. Diverticulosis does not always cause symptoms, but it can develop into diverticulitis, which occurs when the diverticula become infected and inflamed. Diverticulitis can lead to severe intestinal complications such as abscesses, perforations, bleeding, and blockages. Symptoms of diverticulosis and diverticulitis can include diarrhea or constipation, cramping or pain in the lower left side of the abdomen, which may sometimes radiate to the lower back, bloating, fever and chills, nausea and vomiting, fatigue. Treatment. Treatment for diverticulosis and diverticulitis depends on the type and severity of a person's symptoms. A doctor may recommend dietary changes such as increasing fiber intake and taking probiotics for individuals with mild symptoms. For people with symptoms of diverticulitis, a doctor will usually prescribe antibiotics to treat the infection. Surgery may be necessary to treat serious intestinal complications. Inflammatory bowel disease. Inflammatory bowel disease is an umbrella term for conditions that cause inflammation and irritation along the digestive tract. The most common examples of inflammatory bowel disease are ulcerative colitis and Crohn's disease. The symptoms of inflammatory bowel disease can vary considerably among individuals, and they tend to come and go in cycles. However, inflammatory bowel disease often causes recurrent diarrhea and abdominal cramping. Some people also experience joint pain, which can develop in the lower back. Some other symptoms of inflammatory bowel disease include fatigue, unexpected weight loss, rectal bleeding, loss of appetite, nausea and vomiting, skin rashes, jaundice. Treatment. Treatment for inflammatory bowel disease typically involves a combination of medications, lifestyle, and dietary changes. Doctors may also recommend bowel surgery. People with symptoms of inflammatory bowel disease should see a doctor for an evaluation. Kidney infection. A kidney infection, also known as pyelonephritis, occurs when a urinary tract infection spreads to the kidney. This represents the most serious stage of a urinary tract infection. A person who does not receive prompt treatment from a physician may eventually require hospital care. The symptoms of a kidney infection can develop quickly and may include pain in the lower back, side, or groin area, diarrhea, painful urination, urine that is dark, cloudy, or foul smelling, fever and chills, nausea and vomiting, a loss of appetite. If the infection leads to sepsis, a person may have symptoms such as confusion, rapid breathing, or shortness of breath. Treatment. A person with symptoms of a kidney infection should see a doctor right away. Doctors typically prescribe a course of antibiotics to kill the infection. People who develop serious complications may require hospital treatment, which can include surgery in rare circumstances. When to contact a doctor? Adults should contact a doctor right away if diarrhea lasts for more than 2 days or if symptoms of dehydration develop. People should seek immediate medical attention if they have any of the following symptoms: a high fever, persistent vomiting, severe pain, stools that contain blood or mucus, 6 or more loose stools in a period of 24 hours, a loss of bowel or bladder control, a loss of sensation or function in the legs or feet,